There's a doctor in the house. Dr. Chris Luke is back with us. Good to see you again, Doc.
Hi, Dahi.
All things first aid today.
Yep.
Lovely stuff. You're like Alan, who was in here earlier on with all the hardware stuff.
Ones I prepared earlier.
So there is a pre-budget and a post-budget.
That's right.
First aid kit.
Yeah.
Tell us about the.
Well, I'm particularly interested in first aid because I look after about 60 under-12s in the Corcon club, not far from here. So I've had to do a lot of thinking and acting in terms of first aid, and I've concluded after a year or two of doing this that you actually don't need the pre-budget kit.
The expensive one.
The one that'll cost you 20 or 30 euros that you seldom ever use. And in fact, I think the new austerity kit is this one. And honestly, for €1, I think you have all that you need.
For €1.
Well, I mean, 95% of first aid incidents are bumps and scrapes and tears.
Yes.
So I think every mummy in her handbag and every daddy in his duffel coat on the sideline should have this €1 kit. Well, basically you have two tissues, and because boys and girls will cry typically for a couple of minutes and they need to blow their nose or have their tears dabbed or whatever. So these are very useful both as pads and as tissues. You need what I would describe as age-appropriate painkillers. So really two, soluble paracetamol and Nurofen products. And basically you need two Band-Aids, either the kiddie-friendly or the serious teenager Band-Aids, because the vast majority of incidents involve a simple scrape or a bump. And that's it, really. The bag itself is multi-purpose. It can be used, first of all, to store the bit of kit. Secondly, it can be used to put ice on any sore bit. So you can put a bit of ice from the freezer into that and then apply it to the sore bit. You can put a tooth. If a tooth is pulled out, you can put it into a little bit of milk or even a bit of saliva. I know it sounds horrible, but saliva or milk are the ideal liquids for a tooth that's been pulled out. Or you can use it, of course, for the bloodied tissue.
Yes. When you talk about the tooth and the milk or saliva, is that to hold it, or explain that?
Teeth are very delicate, and if they come out, as they often do, they expose the roots. And the roots are very susceptible to early death or damage if they're exposed to the fresh air for too long. So they need to be cleaned under a running tap of cold water. Now what you do is you must hold the tooth by the white bit, the crown, and do not touch the roots at the bottom. Run the roots under the tap for a minute or two, and then ideally you can try and put it back in
if
you're brave enough. Yeah. But if you're not brave enough and it's too damaged and the child is too distressed or the teenager is too distressed, then what you do is you put a little bit of milk in the plastic bag and you put the tooth into that. Or if you have a senior player who's, say, 17 or 18 and has got a bit of cop on, they can actually store the tooth in their own gum. But of course you can't trust a distressed child or youngster to do that.
Okay. Yeah.
What else do you have there? You have a tea towel there.
I have other things. Now, just basically the austerity rules.
Chris, do you mind if I interrupt you just one second? Because we've just got this through on our iPads here. Colette got in touch with us via text. Could you please ask the doctor what to do in case of slicing off part of your finger while cutting vegetables? Now, this is the similar type of thing.
It's exactly the same thing. Basically, what
if you chopped your finger off.
Now, you must keep it damp. You must keep it damp, and you can put it into the bag with not tissue that'll melt, but if you have, for example, this sort of simple pad that doesn't stick, that doesn't dissolve with the wet, a cotton wool pad or a linen pad, and then put it into that. Try and keep it cool, and try and get to the hospital as soon as possible.
Would you put ice in it?
Well, that's a debatable problem, because if the ice touches the part that's been torn off for too long, it'll actually cause frostbite. So you don't want the part to have frostbite. Yes. And you'll cause frostbite if the bit of tissue lies exactly beside a bit of ice. So what you want to do is keep it cool. Yes. So you might put it into that, then surround it by, say, damp cloth, and then put a little bit of ice layered beyond that.
So a severed finger, that can be put back on?
A severed finger, you put, again, into the bag.
Yeah, it can be put back on.
Wrap it in the hand cloth, okay, and then into a bucket with ice around it, but not directly.
Not directly on the ice.
And of course, the hand cloth is also another very cheap and cheerful way of using as a bandage, which can be used to stem the bleeding. And what you need to stop bleeding is you ideally keep the part that's bleeding above the level of the heart to use gravity, and then apply gentle but firm pressure in the vicinity of the bleed.
This actually could be something as well for our texter there, Colette. You probably just sliced a part of your finger off. Should she hold it, or that's what she should have done?
Hold it up
obviously
above
it's done
the level
now.
of the heart. Run it under a cold tap. Press it firmly like that. And one of the tricks you can use again is a rubber glove. You put the rubber glove on, like so, and you cut the tip of the rubber gloved finger off, and then you roll it down like so, and that will actually apply pressure to the finger itself and stop the bleeding. That's a very handy thing to do, and then off with you to the hospital.
It's fascinating because these accidents happen a lot more than we realise, especially when you're cutting your finger and all that. Actually, it happened to me, but I didn't slice my finger off, and I ran to the chemist. They just put the stitch. Should you actually? That's a good question. Should you at home have those little stitches that you can buy at the chemist?
The paper tape. We call them steri strips.
Yeah.
They're extremely handy, but again, there's an element of bravery. I mean, I was talking last night at a first aid course, and I'm saying that if you're in Barley Cove or Brittas Bay or, Mulranny or whatever, and you're an hour or two from the local hospital, and your son or daughter gets a cut on a rock on the beach, and their scalp is bleeding, one of the things you can do, which is a very ancient tradition, is the so-called Mohican technique, where you clean the wound, you stop the bleeding with your tissue. Once it's stopped bleeding, you then get the hair on either side and you braid it over
like plait
the wound. You plait it literally, you do it tight so that the wound edges are brought together. And that's called the Mohican hair technique. It's a very useful device for stopping the bleeding. And often by the time you've got to the hospital in an hour or two thereafter, or the next day, you don't need any further suturing or stapling or even glue.
Yeah. This is actually very basic stuff, but I'd never think of the braiding of the hair.
One of our problems is that almost a quarter of the population comes to hospital, the accident emergency department, every year. 1.2 million of the Irish population. And a lot of them could avoid going there and then with a bit more first aid or a bit more immediate medical care.
Show us what you're going to do with that dishcloth.
Well, the dishcloth, again, you can spend money on an expensive first aid kit and a triangular bandage, but this is adequate for a triangular bandage. If you can find yourself a sort of square tea towel, you can turn it into a triangle, and with the long line in the middle, you point towards the sore side, whether it's an elbow or a wrist or a collarbone, and that's sufficient into the day, and you bring it up around the child and you tie it, or you use a safety pin, and Bob's your uncle, you have a sufficient splint to take them to hospital.
Now, if we just look at, say, if you go people who play football and soccer and rugby and hurling, say, all weekends and all these different injuries, what are the most common ones you come across?
We were thinking about this last night. The commonest injuries in serious football, rugby, Gaelic, hurling would be to the acromioclavicular joint, the ACJ. That's the tip there, the joint between the collarbone and the scapula. The ankle, obviously, the outer ankle, the lateral ankle sprain. The back of the knee, which is the hamstrings. The thumb, if you fall on the edge of the thumb, you break that, you dislocate that. And of course, bangs to the head, knocks to the head, concussion. And I have to say that concussion is the most scary and controversial thing at the moment. And you'll be aware, Daithí, that in Tralee there was a near tragedy there a couple of weeks ago with a young boy in the rugby club who got a bang to the head. It was treated routinely, but he became quite ill very soon, and it was only the swift action of the guards and getting him from Tralee to the neurosurgeons in CRH to save his life.